Welcome to Learning Unit number 14. Learning Unit number 14 is our last full learning unit where we have new information. And the information that we're going to look at in this learning unit is environmental health and planetary health as well. So when I say environmental health, that is the branch of public health concerns with all aspects of the natural and built environment that impact on human health. According to authors that I'm citing here, environmental health is where we live, what we eat, and how we interact with the world around us can tip the scales between healthy or not healthy. For example, if you live in a neighborhood with unsafe sidewalks or polluted air, outdoor air pollution is called ambient pollution, then it's difficult to get outside and to exercise. Similarly, what your home was built with, what insects live nearby, and even what food you have access to can all impact your health, on your health and the health of your family. So for this learning unit, which I want to tell you right off the bat is a shortened learning unit, so that it will provide you time to do your final course reflection, which is in lieu of a final exam. So in other words, we don't have a final exam in this course, but we are going to look at, we are going to reflect on what we learned in this full course. So learning unit number 14 is shortened as far as the dates. So we're going to take that shorter period of time and we're going to focus on really 3 issues that have the largest impact on the global burden of disease, and especially in low and middle income countries. And these 3 issues that have the largest impact on the global burden of disease are unsafe water, sanitation, and hygiene, what your authors call WASH, or W-A-S-H, all capitalized. Water, sanitation, and hygiene. So let's take a step back. This course started with us discussing the burden of disease. And I want to make sure that you recall what the burden of disease. And we use 2 indicators, and the text has used these indicators throughout that can be used to compare how far different countries are from the state of good health. So that's the burden of disease. And what we're looking at are 3 concepts: morbidity, which remember is disease and illness, mortality, death, and disability. So the 2 that we look at, that if you want to refresh your memory of how we use these 2 terms to measure the burden of disease, is the Haley and the Daily. The Haley is the health-adjusted life expectancy, and Daily is the disability-adjusted life year. So these are indicators that we use so we can compare different countries to see how far from the state of good health is the U.S. compared to a country in sub-Saharan Africa, for instance. So throughout our course, we've really looked at the burden of disease. But after we look at WASH, the 3 issues that have the biggest impact on the global burden of disease in low and middle income countries, then we're going to also look at ambient particulate air pollution. So ambient particulate air pollution, you're going to read in your book, that's outdoor air pollution, as well as indoor household air pollution. And we're mostly looking for household air pollution. We're mostly, again, looking at those low-income countries that they burn solid fuels to cook their foods in the house with limited ventilation. But then we're going to shift our focus to look at ways in which nurses, yes, us as nurses can be involved with environmental health and why we should be involved. And we're going to do that by reviewing a presentation that was given by the American Holistic Nursing Association. And again, this is the last content that we cover. So by the end of this learning unit, we are going to be able to really be able to talk about the important environmental threats to health in low and middle income countries, and describe some of the most cost-effective ways of reducing the global burden of disease and environmental health problems, and really explore the impact of environmental change on human health. You're going to do that by looking at Chapter 8. Now, Chapter 8, I've highlighted the pages that I really want you to focus most on. Right off the bat is starting on page 190 to 205, and then also looking at 213, because 213 has some information on climate change that you're going to need for the quiz. And you're also going to read very short one-pager from Medscape as far as air pollution, ambient pollution, killing 9 million annually. So I want you to take a moment to look at this. And then you're going to, what I just passed by was not something that you need to do. But what I'm asking you is to kind of stretch your mind. For nursing, especially pre-licensure nursing, we focus on caring for an individual, right? We focus on that, and that's important. It's essential as, you know, we go into hospitals and long-term care to be able to care for individuals. But this is asking you to stretch a little bit more of how we can care for our planet's health. And why is that important for those that we serve? So why is looking at planetary health and environmental health, why is it important for nurses? How can nurses advocate for planetary health? So there's some great resources at the end that are specific to nursing. And yes, nursing and nurses are involved in planetary health. So when we say planetary health, how do we define that? Planetary health is understanding the human health impact of environmental change so that solutions can be developed and then implemented. So we know when we talked about mental health, how if we're health focused, we're promoting the health of individuals. When we talk about illness, mental illness, we're looking at more of the diagnostic criteria of depression, etc. So we're looking at planetary health. We're looking at it in a way that we're better understanding how the environmental changes impact on the health of individuals so that we can be an advocate to develop and implement solutions. So planetary health is a positive, right? We're looking at the health, not the illness of our world. So I ask you to stretch your ability to stretch and listen to this video. And in fact, there's going to be a couple questions from the video, and also 8 multiple choice and true false from Chapter 8 and the pages that I really spoke to. So as you're watching this video, I want you to be answering your discussion board. Let's do everything at once, right? You don't have to do it separately. And I'm kind of asking you to share how a toxic environment impacts on our own health and the health of those that we serve. So you can be answering this question as you're watching the video, And it doesn't need to be lengthy, and you don't need to add references, just your discussion board. I want you to demonstrate that you've watched the video and that you've thought about it, and you don't need to reply. And you will be submitting your global health issues paper. And that is the end of learning unit number 14, our last new content. The last time you'll be opening the Global Health 101 book by Richard Skolnick. Maybe not. Maybe you'll be using that as a resource again. But that's going to be the last of our new content. And I'm going to take the next few minutes just to review the final course reflection. So I'm going to switch over. So instead of a final exam for this course, during final exam week, which is December 11th through 14th, you're going to be completing a final course reflection. So you're going to be reflecting on the student learning outcomes for this course and submitting a final course reflection paper. So let's talk about that a little bit. Number one, it's a Word document of 2 pages or less. I'm not asking you to use APA format on this. Just make sure your name is on your paper when you submit it. So by the last day of final exams, you will have completed the 60-point assignment. So what are you going to do? I already said that you're going to look at what were we supposed to learn, right? Those are our student learning outcomes. Every class that you take, every course that you take has student learning outcomes. And for this course, we had 5 of them, and they were right on the syllabus. And here are the 5 learning outcomes. So you can read through those and reflect on that. And then to finish this less than 2-page or less paper, what I'm asking you to do, besides put your name on it, is to write number 1 through 5, right? It's the easiest way to do it. Write 1 to 5. And you don't have to write what number 1's, what the student learning outcome is, because we all know number 1 is examine the determinants of health, health status, and life expectancy, as well as the burden of various diseases on the world population. But you can put number 1. You know what this is. So let's look at number 5, because I've given an example here. Number 5, when you get to number 5, is compare healthcare systems, policies, and care delivery models from around the world. So how do you know that you've met this outcome? So for that, number 5, you're going to think about, oh yeah, we compared health systems. I learned about universal health care. So when did I do that? You're going to look through your discussion boards perhaps, or your learning units. You're going to quickly look through to see, when did we really talk about that? Oh yeah, week 7, we learned about universal health coverage in the UK and Switzerland. So that's going to be how you're going to demonstrate that you've met that outcome. Maybe there are other times that you also, maybe it was in learning unit number 4, you had additional information about healthcare systems from around the world. But that's, I'm asking you to reflect. So I think everybody is going to say, yeah, I did compare healthcare systems. We did it with 3 countries, as a matter of fact, from around the world. So you were able to you're going to demonstrate how you did that. And that's it. And you're going to upload that document in the section right here. So again, everything that you're doing for this course needs to be submitted, whether it's learning unit number 14 that you were delayed on, whatever it is, you need to have that all done by December 14th. I can't accept things after December 14th because that's the last day of final exams. So I've given you till December 14th. If you want to do it early, great. But whatever way, I can't accept any information after that. But I thank you. I thank you very much for a wonderful semester and for all of your hard work and effort. And I hope you find that you did indeed learn a lot about global health. Take care.